What are infectious diseases? How can we prevent waterborne diseases and vector-borne infections? And what are the factors influencing waterborne and vector-borne diseases? Hello and welcome. I'm your host, Dr. Musa Mtombene, and signing with us is Tsepo Maseko, and the feeder interpreter is Ntabiseng Ndlovu. On Vital Signs, we'll look at infectious diseases with a focus on cholera. Coming up on the program, we'll listen to an insert about two sisters who were recently diagnosed with cholera after traveling from Malawi, and another insert about residents from the OR Tambo district that have been struggling to get access to clean water. We'll speak to international NGO Village Reach about their collaboration with Malawi on an innovative approach to respond to the cholera outbreak. We'll speak to a general practitioner about cholera as causes and its complications. And of course, we'll speak to the head of the Center of Enteric Diseases at the National Institute of Communicable Diseases about how the cholera outbreak will be monitored at ports of entry, especially land and air, for travelers arriving from countries experiencing a cholera outbreak, about the high burden of vector-borne diseases as well in the African region, and the region's first aggressive plan for vector control across the continent. Remember that you can be part of the show today by asking the guests that we'll have on any question that you have on your mind. Simply share your view with us on what we're discussing. The number to call is 011-714-0677 or 011-714-0678. Also available on social media. You can find us on Twitter at SABC Vital Signs or Facebook SABC Vital Signs. The show continues after the sad break. Welcome back to Vital Signs. South Africa has recorded a third cholera case this month. The patient is the husband of one of the first two cases announced earlier this week. Now, the first two cases were sisters who had traveled together from Johannesburg to Malawi to attend a funeral. They returned on the bus on the 30th of January, and both patients had developed symptoms on their return to Johannesburg. Let's have a look at this insert.
The initial patient was admitted to hospital after exhibiting symptoms, and a follow-up investigation of close contacts found that the patient's sister and a fellow household member were also symptomatic. Cholera is an acute enteric infection which causes acute diarrhea and dehydration. Outbreaks can occur in areas with inadequate sanitation where people become infected through drinking contaminated water or eating contaminated foods. South Africa is not endemic for cholera, with the last outbreak occurring between 2008 and 2009 with about 12,000 cases. That followed an outbreak in Zimbabwe, which saw a surge of imported cases in Mpumalanga and Limpopo provinces through contaminated water. Authorities call on the public to practice proper hand hygiene and proper food preparation.
Malawi is experiencing one of the worst ever outbreaks of cholera, and confirmed cases have been found in South Africa and Mozambique. Malawi has been using an innovative approach to respond to the outbreak, and joining us from Malawi to speak about this is, of course, Dr. Ali Nafe Kasia, partner at Village Reach, who's one of the leading partners. Thank you so much for joining us, Doc.
Thank you. Thank you very much for hosting me.
Lovely. So I think let's jump right into it and speak about the current status of what the cholera outbreak looks like in Malawi.
I must say it's a dire situation that we are facing. This is one of the most serious cholera epidemics that we're seeing. We have over 40,000 cases to date from last year. We have over 1,400 deaths and hundreds of people in admission in the facilities. So it is a dire situation. We've not experienced this before. In the past, cholera has been tied to the rainy season, when you'd experience a few cases of cholera around the rainy season. But this has been unique and challenging for the country. So it's quite a serious challenge that we are facing as a country.
Now, let's talk numbers. I think you've slightly alluded to those numbers and what they currently look like, but I think numbers are important in reference to something else. So normally the number in theory should be zero, where there aren't any cholera cases, where there aren't any deaths and things such as that. But in this case, there are numbers that are quite staggering. So take us through those numbers in terms of number of infections that you've seen, number of deaths that you've seen, and what the status currently looks like right now. Are you fighting to try save lives, or is it, sloping downwards?
Yes, I think there is a lot that is happening in the country, and the government has this week launched a campaign which is called Ending Cholera Campaign. So the president of Malawi, Dr. Lazarus Chakwera, launched the campaign Ending Cholera in Malawi, which is looking at reducing the number of new cases, but also reducing the number of deaths in Malawi. So just to repeat those numbers, so far to date, we are looking at over 43,000 cases of cholera. We are looking at 1,400, 1,400 cases of cholera deaths in Malawi, but also 800 admissions in the country. And these are huge numbers we are talking about here. So when we talk about our response in the country, we are talking about reducing the number of diarrhea cases that we are seeing. Right now, I think maybe around 500 cases that we are seeing. We want to bring that to zero. I think that would be our target. We are seeing deaths, number of deaths ranging from about 15 to about 25 every day, and we want to reduce those deaths. And so this campaign that the government has launched with partners is looking at reducing these numbers. And so we can, I think, get to the zero number. And I must say, this is not only affecting Malawi. We are seeing within the region that other countries have been affected. And I think this calls for that cross-country collaboration and saying, what are we learning from each of these countries in terms of our response? And so how can we address cholera? But bottom line being, in Malawi, we are faced with this crisis. We are trying to implement some measures to address this. And so we can reduce those numbers.
Now, let's talk about the innovative approaches that you're implementing in order to start dealing with this outbreak and bring that number down to an idealistic zero.
Sure. So Village Reach as an organization, so we work with governments as an international NGO to basically strengthen systems that deliver health products, vaccines, but also health information so that every person has access. And so we can improve healthcare. And so, bottom line being everyone has the healthcare needed to thrive. And so in Malawi, if you look at the response right now, there are a couple of things that we are looking at. Village Reach as an NGO, we have two aspects that I can speak to this morning. One being, how are we strengthening access to medical products, medical commodities? In the face of this epidemic, it's critical that we get medical products and commodities out to health facilities, even in this rainy season, hard to reach facilities. And I think in this case, I will speak to our Drones for Health program, where we are actually transporting samples. So making sure that we can get people tested from hard to reach areas, but also we can deliver the necessary products to hard to reach areas through our drones. And so that's one aspect that we are looking at it in terms of logistics. And it's also worth mentioning that this is often an area which is not prioritized in many cases. And so, when I speak about this here, we do want this area to be prioritized and say, we want the medicines, medical products, vaccines that are needed to address cholera to be available everywhere. And so that's one area that we are helping government in. You may know, I think, worldwide, we have a shortage of vaccines. Malawi has so far done 6.8 million doses of vaccines in the country. So we have done that vaccination, but now we are looking at getting more vaccines into the country. And once we get that, Village Reach as an organization, we are committed to support government with other partners in terms of that, making sure that people have access to those vaccines, as well as other medical products. The other area I can speak to in terms of our innovative approach is that at a minimum, people need reliable and most accessible health information. And so when you look at the work that we are doing in Malawi, we have a national health hotline that Village Reach transitioned to the Ministry of Health a few years back. And that hotline has now integrated cholera information, but also provides an opportunity for callers to speak to health workers and get up-to-date information around clarifying misconceptions, but also where they can be referred for services. It's critical in the response anywhere in the world, but also in the region, that people must have up-to-date information. And this is what we're doing in our work, as Spirit Reach. And the other thing that the hotline is helping us to do is that it helps us to generate information around what are the myths and misconceptions that people are having about cholera. So you understand that, with the cholera outbreak, people have so many misconceptions and thinking, this is caused by something else, probably, those challenges that, somebody is trying to wipe out a community and so on. And so we need to make sure we're providing reliable information that people can access in real time. And that information helps in terms of decision making. And that relates to my third point, which is data. I think we need information in real time, I think, to be able to make those decisions quite quickly.
Well, thank you so much, Doc, for joining us and telling us what your organization is doing, working hard to end cholera. And then, of course, was Dr. Al-Inafe Kasia from the international NGO Village Reach. After the break, we'll speak to Dr. Marlon McKay, GP, about the cholera, its causes and the complications. Stay with us. To vital signs. Now, the link between lack of clean water and sanitation and avoidable health risks has been well established, making access to safe water and public health imperative. Residents in some villages around the OR Tambo district have been without clean, drinkable tap water for years. Without piped water, this often means that the community members have to fetch their water from rivers where they share the water with animals. Let's watch some more.
Clean water is a major problem throughout the OR Tambo region. Many villagers use traditional methods to source water from the streams. Fraud and corruption allegations over a multi-million rand bulk water project at OR Tambo district municipality are a major concern. Makumsheni villagers in Mkanduli believe this diminishes chances of them accessing clean water.
We heard from the news that the money that was meant for our water project in this village has been defrauded. Millions of rand, and we are shocked because we do not understand why these people are so heartless, why these people are so selfish. They do not care about us. We are just non-existent to them.
A few kilometers from Makumsheni, Machoma village was also meant to benefit from the water project. Residents have been waiting for water since 1994.
We are fetching water from the bottom of the stream. On the upper side of the stream, people are discarding pampas. We are competing with pigs and sheep to get water from the same stream. Sometimes we are forced to wait longer. It's a shame because even this Mkanduli town is dependent on this small stream. Even the township Zwelicha, and we do not want water tanks, we need tap water.
Sharing water with animals has been with us for decades. People do their laundry here. At one time, there was a cholera outbreak in the village because of unhygienic water from the stream. People died due to the cholera outbreak. We were promised that the water problem will be addressed, but that never happened.
Traditional leaders are calling on the government to intervene.
No, we feel very bad because this is a false statement. We don't have water at all. If the government can you please, government, assist us, more especially with water. Water is very, very important. We are pleading government to assist us.
These residents feel betrayed and neglected by their own government. They say the only thing they received from the authorities are pit latrine toilets after the outbreak of cholera 10 years ago. The fraud and corruption allegations are under investigation. I'm Gruleko Nyembezi, SABC News, Mkanduli.
According to the Department of Health, cholera is not endemic in South Africa. Now, the last cholera outbreak in the country was over a decade ago, with about 12,000 cases following an outbreak in neighboring Zimbabwe, which led to a surge of imported cases and subsequent local transmission. Now, the infection is obviously mild and without symptom, but can sometimes be severe and life-threatening. Joining us is GP Dr. Marlon McKay to discuss cholera, its causes, complications, and many other things. Thank you so much for joining us, Dr. McKay. Nice to see you again. Let's jump right into it and discuss what cholera is. So let's start off with what cholera is.
So cholera is an infection. It's a bacterial infection. We know the organism that causes it, called Vibrio cholerae, and it affects the gastrointestinal system. So the main symptom is diarrhea. And it's usually a profuse watery diarrhea. I remember from medical school, we referred it to as a rice watery stool. And even, as you mentioned, in some cases can cause a mild illness. In others can cause such a profuse watery diarrhea that they become dehydrated, and dehydrated very, very quickly, which of course, if we don't get replacement of those fluids, can lead to kidney failure and can lead to death. Patients can die from it. So essentially a bacterial infection, and the source is, as we've been saying here, is contaminated water that has been contaminated usually with human feces.
Now, we speak about a lot of things, about, what cholera is and things such as that. But the important thing is also finding out who's at risk of getting cholera. The discussions around hand washing, the discussion is around, sources of water. So who's at risk of actually getting cholera?
So the main source of, the main link is when people do not have access to healthy, safe water, usually piped water, potable water, and sanitation. So the moment there is a link between feces or anything getting into the water, contaminating the water, and people having direct access to this water, it immediately puts them at risk. That's directly, and then indirectly as well. If that contaminated water is then used to cook food, it gets into the food, and so when they eat, they are at risk of getting cholera. So the main starting point is safe piped water that people can have, and not having to take water from rivers and dams where it could potentially be contaminated already.
Now, cholera has been linked to a lot of traveling. Can you take us through why that is something that is noted?
Yeah, so with traveling and border crossing, remember, even when patients are, or people are infected with cholera, and they may have mild illness, sometimes with symptoms, sometimes very mild symptoms, they never go to a doctor, never gets treated or diagnosed. And these can still shed the bacteria in their stool for up to 14 days afterwards. So even long after they've left that area, they could still be carrying the bug. And so this is why traveling is so critical, and maintaining only using safe water that is not contaminated is very important. So most patients can be asymptomatic or mildly symptomatic and not even know that they are carriers of cholera at that time.
Now, a lot of people are found to, live in these areas where there are these contaminated sources of water, and then they would, use the water, or then, not have safe hand washing techniques, and then would touch food and things like that, and then people get sick. So in terms of a picture of illness, why is it difficult to diagnose cholera? Because you've described it as this diarrhea where people would assume it's a self-limiting thing where I'll just drink some water, it'll flush itself out, and I'll feel better in a day or two. So why is it so difficult?
Yeah, because things can happen so quickly. Again, on the one hand, you may have mild illness, which we just take for granted. It's a bug, gastric bug, we treat it on spec, whatever the case is. But in the specific case of cholera, one needs to be highly aware of this rapid presentation. In other words, someone can go from well, and within a matter of hours can be very, very ill, rapid dehydration. So anytime we suspect someone has severe diarrhea, loose watery stool, and gets very ill with severe dehydration, literally within hours, one has to suspect cholera. And this is where, as we're talking about, communication and awareness is so important, because this is a unique picture to cholera. It's not just the normal diarrhea. If someone dies with diarrhea within hours, for me, that is cholera until proven otherwise. So that type of awareness and that sense of urgency is critical to limiting an outbreak when we do have cholera.
What does the picture look like in children? So for adults who would be able to say that, I've got this diarrhea, my stool's been running, and, be able to describe these things, does the picture accelerate much quicker when children are involved?
Absolutely. Remember, children have a smaller body surface area. So relative to their mass and their surface area, they can lose fluids much quicker and get very sick. So what we're trying to advise patients or parents, especially with children who may have this picture, is to look for signs of dehydration. So you get the sunken eyes, the dry skin, what we call decreased skin turgor, decreased urine output. So you're not changing the nappy as soon as possible. Your child becomes very fatigued and lethargic, and almost to the point of losing consciousness. So, and with this picture of profuse watery diarrhea. So when you see your child is really not looking well, not passing urine, not as active, wanting to lay down, eyes are sunken, the tongue is dry, lips are dry with the diarrhea, cholera until proven otherwise, it's really a medical emergency. Get to the local clinic ASAP.
What precautions should one take to ensure that they don't necessarily get cholera?
Yeah, I think it's important that again, awareness, communication, information, correct information is passed out. But one of the things are, because water is such an important source of contamination or infection, one needs to protect oneself with water. And the usual advice is boil the water. There's also the information that one can take a capful of normal household bleach, and in a bucket of 20 to 25 liters of water, mix it in there, and then just leave it to stand. Leave it to stand overnight, 3 minutes minimum, at least overnight, and that at least can so-called sterilize the water so that it is safer for cooking and for household use. But essentially, it's just not having contact with any water that could be contaminated. And improved sanitation, hand washing, hand hygiene is critical to prevention of spread. And this even includes us as healthcare workers. After you examine a patient, make sure that we practice meticulous hand hygiene.
How do we treat cholera then? So once we've got people that have been diagnosed, or you have someone in the household that has cholera, what avenues should we follow in order to treat them?
So the main symptom or the main issue with cholera is diarrhea, which leads to dehydration. So it follows that treatment can be as simple as just oral rehydration therapy. The mainstay of treatment is actually rehydration. So you can do it orally with an oral, where you use 1 liter of water, 8 teaspoons of sugar, half a teaspoon of salt, and get them drinking, get that water. Even if you feed it with a teaspoon, it's absolutely vital that you replace. As they are losing the liquids, keep on giving it to them. Fortunately, vomiting doesn't always have to be a mainstay of the symptom. Sometimes vomiting is mild, so they're still able to take in. If the vomiting or the diarrhea is more severe and you cannot get them to take in orally, must be taken to hospital where they can be given intravenous rehydration fluids. Critical. And I think an important tip, Doc, is also don't rush to give these over-the-counter remedies for diarrhea and for gastroenteritis. We do not want you to be using sweeteners. We do not want you to be using medications that stop what we call anti-motility agents, things that stop diarrhea. The organism needs to pass out. The mainstay of treatment is rehydration. Once the patient is in hospital, we do use antibiotics. So prophloxacin is the mainstay. And then also children under the age of 5, we do use zinc supplementation. But it's not magic treatment to stop it. It's absolutely vital that we rehydrate the patient so that they don't end up with the complications.
Now, there's been talk of vaccines, where cholera vaccines are being used. How would these play a part in stopping the spread of cholera, and what is the use of taking the vaccine?
Yeah, so to my understanding, as we have mentioned earlier, there is also a shortage of vaccines, but there are currently 2 oral vaccines that are available. Because it's not endemic in South Africa, there are limited uses of the vaccines, but it's important during an outbreak that we get as many vaccinated as possible. Obviously, the vaccine is not 100% effective, and I think in South Africa we tend to use it more for these big sporting events, where, especially the water sports like where they canoeing or swimming. But yes, vaccines, as with many vaccine-preventable illnesses, vaccines do play a vital role in the prevention of cholera.
And lastly, Doc, as we let go of you, I know that, we're almost out of summer, so a lot of water play won't be necessarily something that people need to be aware of. But in terms of access to water, what should children and even adults be aware of?
Yeah, so for now, we should be treating water as always being suspicious. Make sure that our water sources are safe. Make sure that adequate sanitation has been provided. Make sure that the water is not contaminated. So make sure the water is boiled. Make sure if you're eating fruit and veg, make sure it's been peeled. So proper cooking techniques, proper water sources. Make sure it comes from piped sources and not just from open water. And I think with the amount of rain that we've been having and water been standing all over the show and the rivers are overflowing, there's a greater risk of something like this going wrong. So I think we just need to get back to basics, good information, good awareness, stay aware of what's happening, where the cholera outbreaks are, and how we can limit the spread of cholera within our community.
Well, thank you so much for joining us today. That was General Practitioner Dr. Marlon McKay. After the break, we'll speak to Dr. Juno Thomas, the head of the Center of Enteric Diseases at the National Institute of Communicable Diseases, about how the cholera outbreak will be monitored at ports of entry, especially land and air for travelers arriving from countries experiencing a cholera outbreak. Stay with us. Back to Vital Signs. Now, the Department of Health has called for vigilance as the country has recorded 3 lab-confirmed cases, 2 confirmed cases of cholera imported from Malawi, and the first secondary transmission case. Now, the department has activated outbreak response teams, and surveillance efforts have been increased, working closely with the National Institute of Communicable Diseases and the World Health Organization to monitor the cholera cases. Joining us now is Dr. Juno Thomas, the head of the Center for Enteric Diseases at the National Institute of Communicable Diseases. Thank you so much for joining us today.
Thank you.
So let's start off with a history. So maybe a step back from what we're currently facing, but a history of cholera in our country. What has our history of cholera been like?
So currently the world is in what we call the 7th global pandemic.
Okay.
There have been, 6 previously recorded pandemics, and now we're in the 7th since the late 60s.
Sure.
So the first cholera cases in South Africa with this pandemic were recorded in mid-1970s and were predominantly among mine workers that had travelled from other southern African countries and imported the cholera back. But, since then we have had some major outbreaks of cholera in the country. The last being, as you mentioned previously, in 2008, 2009, where we had, over 18,000 cases and many deaths were reported. Since that time, we get what we call sporadic cases. So we see the odd case, and the majority of those are imported cases. So they're in people who have travelled to countries where cholera transmission is ongoing, and then they develop cholera on their return. So since the last outbreak in 2008, 2009, which is over a decade, we've only picked up this pandemic strain in travellers. I think it's important just to keep in mind that cholera is something that most clinicians are aware of. They might not have seen it every day in their general practice, but I think in medical school, as Dr. McKay was saying, you get taught about the profuse rice water diarrhea, and that's something you must think of. And I think numerous alerts have been sent out to healthcare workers across the country to be vigilant and to keep it in mind. And we are getting reports of a lot more lab testing being done on patients, even if they haven't travelled. So I think what we call an index of suspicion is very high. Also important to remember is that it's quite readily diagnosed in the laboratory. It's a simple culture method on the stool. And, all of the public sector labs that do microbiology testing can culture for cholera. And obviously the private sector laboratories all offer the testing as well.
Now, we've spoken quite a lot about this idea of traveling, and then you get cases where people haven't traveled. So explain the difference and why one may lead to the other.
Right. So As you mentioned earlier, cholera is not endemic in the country. That means that there's not persistent cases and ongoing transmission between people within the country. But what can happen is an imported case, so someone who's traveled to another country with cholera and comes back and is ill, that person is excreting the bacteria in their feces. And if that then contaminates water sources that many other people are exposed to and used for drinking or for cooking, sometimes you can get contaminated food as well, then that can lead to much larger outbreaks. And that's exactly what happened in the 2008 and 9 outbreak. It was predominantly a Zimbabwean outbreak, and then many people crossed the border to seek health care, as well as travelers to and from Zimbabwe. And then there was contamination of water sources in parts of Mpumalanga and Limpopo, and that led to dramatic spread amongst local communities.
Are there areas of concern or areas of worry that we should be aware of to say that, you know, if you are, for instance, someone that lives in Musina and you're finding yourself having lots of diarrhea, that we should be more concerned about that sort of symptomatology and you should go get treated, or, you know, isolate yourself from the people that you may live with and things such as that?
So, I mean, at the moment, the major risk is having traveled to one of the cholera endemic countries. And you mentioned Malawi has the largest cholera outbreak really on record for that country. But there are also outbreaks ongoing in Zambia, you know, in the areas neighboring Malawi where there's been spillover, and also very concerning in Mozambique. There have been reports of cholera around the Maputo area. Okay. So firstly, anyone who's traveled, who returns with symptoms, you know, that's obviously is a major risk that they've contracted cholera there. Anyone who lives as a household contact with someone who's recently traveled to those countries and then developed symptoms, they're also at high risk. And then people who live in areas where there's you know, not sufficient safe water supply, and they make use of untreated water sources, and there's very poor sanitation, and perhaps many returning travelers where there's a risk that there's contamination of the water sources, they would be at high risk. And that's why we've advised healthcare workers countrywide that anyone presenting with profuse diarrhea or severe dehydration, even if they don't necessarily have a travel history themselves, should be, you know, considered a suspected case and tested for.
Now, a big thing that a lot of people would, you know, want to be aware of, or, you know, always want to, you know, have their ear on the ground about, is this idea of the numbers that we currently have. So we're sitting at 3 confirmed cases. Should we be worried that the number is going to increase? Now, I'll say this with the background of what we mentioned about the cholera outbreak more than 10 years ago, where a small number of people come in and then water sources are polluted and then it just goes south from then on. So should we be worried when we've got 3 confirmed cases now?
There's definitely concern. Okay. I think the National Department of Health are taking it very seriously. The World Health Organization country office is involved, and there's a multi-sectoral outbreak response team at a national level as well as at provincial levels. So the provinces are conducting risk assessments and doing contingency planning, and I think with our previous experience, you know, we know that cholera outbreaks, you know, can easily happen once you have a lot of imported cases. So certainly there is a risk, and healthcare workers need to make sure that they diagnose and treat people early as well, so that we can try and prevent, you know, onward transmission and contamination of water sources that lead to larger outbreaks. But I think the general public also need to make sure, Dr. McKay mentioned that utilizing safe water is critical. So boiling or treating it with bleach. Sanitation is often much more complex, but hand hygiene and food safety and safe water, I think those are critical elements that all communities should focus on. So obviously information and education and social mobilization is critical in this response to the confirmed cases, because it is the communities most at risk that need to be aware of what they can do to protect themselves.
The communities need to be aware of what they need to do to ensure that they are no longer at risk. Of course, we continue our discussion with Dr. Juno Thomas, the head of the Center of Enteric Diseases at the National Institute of Communicable Diseases, about the high burden of vector-borne diseases in the African region and, of course, the region's first aggressive plan for vector control across the continent. Stay with us. Welcome back to Vital Signs. Now, the African region has a troubling high burden of vector-borne diseases. In response to the increasing threat of vector-borne diseases, 47 health ministers endorsed the region's first aggressive plan for vector control across the continent to improve surveillance, better coordination, and of course, integrated actions across sectors and well as diseases. Now, we'll continue our discussion with Dr. Juno Thomas, the head for the Center of Enteric Diseases at the National Institute of Communicable Diseases. So we spoke about cholera, and I think just to wrap up our discussion around that, how do we solution the problem like a Malawi has so that we don't find ourselves in a position where we're sitting at 40,000 cases and we're losing people on a daily?
So I think the key thing is to identify cholera cases early, treat them appropriately, so that the public health actions and interventions can take place. So we prevent onward transmission and we prevent contamination of water sources. Once you have established cholera transmission within communities, then you get to sort of other types of interventions where you have to supply safe water and improve sanitation and provide adequate healthcare infrastructure to treat for a surge in patients. As mentioned, there's currently a global shortage of oral cholera vaccine, and it's being prioritized for countries that have large outbreaks. Obviously, if we were to have a large outbreak, the government would apply to the international coordinating group for the cholera vaccines. That would be one mechanism. But I think early recognition of cases, early public health investigations and interventions to prevent contamination of water sources is key.
Now, let's talk about vector-borne diseases. Now, I'm sure a lot of people are sitting at home wondering, who's Vector? What does he do? What's that all about? So briefly explain what a vector-borne disease is before we open up that discussion.
So a vector is an organism that, a living organism that will carry an infection. So it's usually viruses, bacterial parasites, from one person to another or from animals to people. So vectors are typically insects, and mosquitoes are important vectors, snails, different kinds of flies, ticks, and fleas. So they all fall into the group of vector-borne diseases.
So what diseases do we then need to be aware of that come from vectors?
Okay, so the most important vector-borne disease on the continent is malaria. It's still one of the biggest killers, particularly in children under 5. And South Africa is still endemic for malaria in parts of Limpopo, Mpumalanga, and KZN. And we see a few thousands of cases every year in those provinces, as well as imported cases, people returning from predominantly other neighboring countries that also are endemic for malaria with infection.
So let's maybe just touch a little bit on that malaria. What makes malaria such a big problem?
So malaria can lead to life-threatening illness. You can get different forms of malaria. It can cause kidney failure. It can cause what we call cerebral malaria, where it infects the brain. It can lead to massive bleeding. So there are many ways in which you can develop complications and potentially die. And children under the age of 5 are typically most at risk for getting severe disease and dying. Pregnant women as well, and also people who are HIV infected. So they are highly vulnerable groups.
Now, with this idea of vectors, traveling also goes hand in hand with it, where, you know, it's very difficult to discuss vectors and not speak about traveling. Why are these two besties? Why are they always, you know, mentioned one after the other?
Okay, well, there are two important things with vectors and vector-borne diseases and travel. Firstly is that people travel, so they come back with the disease, and then the vector will feed on a person and then transmit it to another person. So that's the way that the disease gets propagated within communities. But also sometimes we see what's called taxi or airport malaria, where the actual vector comes along, is also imported and travels. So every year we see several cases of malaria in Gauteng, where the patients themselves haven't traveled, but they live next to taxi stops or bus stops or near the airport, where it's likely that a mosquito came in through luggage or in the vehicle, and then, you know, survives just for a short while, but long enough to infect someone. But typically it's travelers human travelers that bring infection in. And if you've got the right kind of vector in the community where the infected person is staying, then there's the risk that the vectors can bite, become infected, and then spread infection to other people in the community.
What makes vector-borne diseases so difficult to eliminate?
So the issue is that you need to address the vectors themselves.
Okay.
It's not enough just to try and treat people so that you have less infected people and that way try and control the disease. But you have to address the vectors themselves. So there's now a global vector control program, and many African countries have signed up to this, and a lot of strategies looking at monitoring what vectors are spreading disease, where are the vectors concentrated, where are they breeding, because what we're seeing now is we're getting expansion of what are called the vectors' normal living habitats, and vectors are also changing their normal habits. Like, for example, some mosquitoes are now biting in the day as well as at night. And some vectors are also becoming resistant to insecticides that are used to control them. So we need to closely monitor the vectors, and important vector interventions like spraying insecticide indoors in communities that experience seasonal malaria really does reduce the transmission of malaria and control vectors to a large extent.
Does control of vectors have a positive influence in an area where you'd have such problems? So something that you mentioned earlier on, this idea that, you know, malaria has been something that we're dealing with for the longest time, where, you know, eastern parts of South Africa, so Limpopo and Mpumalanga, have been struggling for years. But are there things that we can do to ensure that we get to a point where we can say, outside of, you know, the malaria that we acquire from travel, the area has now been clean of this malaria?
Yes, so certainly I think there is a malaria elimination program in place for South Africa, and you know, it involves many components, and the one is that you need to identify and treat patients early so that there are less infected people for the mosquitoes to bite in the first place. And then indoor residual spraying of insecticide. In some areas, perhaps insecticide-treated bed nets may be of value. And then also just environmental reservoirs. So make sure that there aren't standing pools of water after rains where mosquitoes can breed, and that's, that also leads into information and education for affected communities, because social behavior and behavior change is also critical to any success of malaria elimination plans.
Primary prevention, is this something that is possible? That can be done to ensure that we don't have an increase in vector-borne diseases, in cholera, in waterborne diseases?
So prevention is both at a public health intervention as well as a direct vector control intervention. So you need both. You need to be able to detect and treat disease to reduce the number of infected people, and you need to then have environmental interventions like indoor spraying, like controlling breeding sites for mosquitoes, and then you need to have vector control strategies as well.
And lastly, in an ideal world, what do we do at ports of entry? How do we manage our ports of entry to ensure that we're not importing all these diseases?
So, I mean, look, the likelihood that someone's going to be critically ill when they enter the country is very low. So, typically, people might still be incubating disease. In other words, they have been infected, but they don't show symptoms as yet, or they have very mild disease at the time that they enter the country. And in that case, I think information and education is key. It's to tell travelers, if you are coming back from these countries, beware, there are these types of diseases and infections, these are the symptoms, and you must go and seek health care if you become ill or if you are already ill, and tell the healthcare provider that you have travelled. So I think education of returning travellers is key. Monitoring for fever has been shown throughout many different outbreaks, including the SARS-CoV-2 outbreak, has very limited value. And for cholera, for example, has no value because with cholera you don't get a fever.
Not at all.
So information, education, and health awareness for returning travellers.
Well, thank you so much, Dr. Thomas, for joining us today and taking us through what we need to be aware of. And thank you to all the guests that joined us today and were participating and giving you all the information that you need so that you're aware and are taking care of not just you, but your community as well. It is the end of our show. This has been Vital Signs. I'm Dr. Mosam Tomeni. We'll chat again soon.